What I recommend for everybody is getting used to locating that carpal or that median nerve about 4 to 5 centimeters from that carpal row. So from that crease in the wrist, you want to come up about 4 to 5 centimeters a little bit so you can see the extensor digiti, the flexor digiti flexor digiti profundus and superficialis. So without further ado, let's take a look at this. Julius, are you comfortable? I guess that's always important to ask, right? And we are live. Colin, is that coming up? Yes. All right. So as we go, what I want everybody to understand is, and I'll have a cursor here, is as we go through, you can see my probe is a couple centimeters or a couple inches from that dorsal, volar wrist crease. As I come up a couple centimeters here, what I'm looking for is, Jules, go ahead and wiggle your fingers. You can see the flexors here and here. So this is the superficialis. This is the profundus right through here. Thank you. And so what we have is right smack in the middle, this piece right in here is the median nerve. Now it's really easy to locate the median nerve at this level because one, it's nestled between the two muscles, which makes it hyperechoic. So it's easier to see. And what you want to look for is this bundle of grape or this honeycomb appearance right in here. So as you can see, my probe, what I'm going to do is I'm going to start slowly scanning distal. And you can see that nerve is going to start rising a little bit more superficial. So you can still see it right in this region here. And Colin, what is that big muscle that kind of hangs out at the bottom right there?
That's the pronator quadratus.
Yeah, so the pronator quadratus. So once you get past this level here, you're going to see another muscle come into play. And this is the pronator quadratus right through here. Rarely is it implicated at this level. Usually you see it in the pronator window closer to the elbow, but this is something that you do want to be mindful of. Because you know at the level of the pronator, that median nerve is going to start going from the center of the screen between the superficialis and between the profundus, and it's going to be rising up towards the retinacular space. So as you can see this nerve, I want everybody to follow closely right here. Hopefully you can see my arrow. And can I get a thumbs up on everybody if they can see the arrow moving? So can I get a thumbs up on that? I know Julius can. He gave me a thumbs up, but on the screen, I want to make sure everybody can see that. So as I'm here, I'm going to keep sweeping distal into that quadratus right there, that pronator quadratus, looking at that nerve right there, and it's going to start sneaking through that superficialis and coming up on top. Okay, so let me show everybody now that median nerve, hopefully everybody can see right here, is right in this area here. Now on the screen, you can see I'm just at that volar wrist crease, that proximal wrist crease right here. Once I'm right in here, we're looking for this region right here. If you get lost, backtrack yourself and bring it back proximal. Now you can see it right in the middle of the screen again, right in here. As I go distal, watch as it rises up. Couple things that you're going to note while looking at this is, number one, in this region here, it's a rounded nerve. It's hyperechoic, and it has that nice honeycomb appearance. Now, what happens is as it passes and goes superficial to the superficialis, and it goes through this region here, you'll notice a couple things. Number one, it is not as hyperechoic. Okay, so it's this one right in here. And instead of being circular, it's more ovoid. And the reason for that is because it's under pressure. Now, when it's in the more proximal region through here, it's between two muscles. Okay, so now we're looking at a differentiation of the physics here. Okay, because it's nestled between two structures that have more fluid in them compared to the nerve, what you're going to see is it's hyperechoic. As it gets distal, and you see it up in this region here, and I just want to make sure everybody understands where it is. Right in here, it's more oval and it's more hypoechoic, okay? And that's because it's not shrouded by two water-filled spaces, or at least more water-filled spaces in muscle, okay? So as we look into this, so I want everybody to look at this, at the hand here, our big landmarks at this level, at that proximal crease, is going to be the scaphoid and the pisiform, okay? So if you're going to be taking the RMSK exam, this may be on there. So they might have questions similar to what landmarks, and if you can isolate those landmarks, it becomes much easier to locate the median nerve. All right, so let's get our bearings here. We're back at that proximal row. You can see the median nerve right in here. As I sweep a little bit more distal, you'll see a bony outline. Let me get that lit up for you right here. There's a bony outline right here. That's on the radial side, so that's going to be the scaphoid.